Photos of President Trump's bruised hands prompted a rare public medical update. But what really happens behind closed doors when a president's health is at stake? Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the chairman of UConn Health.
Our guest today is Dr. Jeffrey Kuhlman, sometimes referred to as Leno by certain presidents. He's former physician to President Barack Obama, and he's author of Transforming Presidential Healthcare, which offers a rare insider's look at the protocols, politics, and people behind White House medicine. Dr. Kuhlman, welcome to CareTalk.
Good to be with you both.
And Dr. Kuhlman, maybe we should sort of expand on David's use of what another president had called you. Maybe you'd tell us a little bit about the anecdote with President Bush.
Sure. So I was a White House physician from 2000 to 2013. So the last little bit of President Clinton. He traveled a lot. The second term, he was kind of in trouble at home a little bit. So always try to cement his legacy with President Bush. I was there during his time. And he was that firstborn fighter pilot, successful dad, the first NBA president. So he would kind of take a stick, poke you a little bit, and want you to poke him back, just not quite as hard. So he would give different people nicknames, and that was just his style of connecting with them. And so for some reason, he called me Leno, and it got to be that people, even in the White House, who I took care of, they couldn't remember my name, but that's a better nickname than Doc. And would just say, the doctor, Leno. And when he went on the, Tonight Show, he and Jay Leno would have a good laugh about it and show pictures. And then later, during President Obama, he picked me to be the physician to the president. So, it's a good thing, red or blue. Luckily, they're the same all inside from a biologic standpoint.
How do you end up becoming the White House doctor?
Throughout most of history, it's been a military physician. The president can pick one person to be the political appointee, and sometimes they pick a family friend, but sometimes more often they just go with the senior most White House physician that's there. The Army, Navy, and Air Force each have doctors that make it up. Today, there's one physician to the president, and then there's maybe 6 other White House physicians to go on the trips, do the preparation.
It's hard to imagine a more intimate relationship than the White House physician to the president at all presidential periods or periods of extraordinary stress. What an extraordinary privilege to be able to kind of serve the president.
Yeah, it's the ultimate occupational medicine job. You work with them. You don't want to get in the way, but you want to provide the support. I always told the 5.5 presidents I cared for, no policy, no politics, just trusted medical advice. So that's what I felt my role was.
So let's talk about another president with a penchant for giving nicknames that sometimes are a little less friendly and don't always invite a pushback, gentle or not. What's your medical take on President Trump's recent diagnosis of chronic venous insufficiency?
So, to be clear, I've never met him. I've never physically taken care of him. So this is just from afar, what I can read in the what's been released. So there was a one-page statement that Dr. Sean Barbabella released in the past week. Chronic venous insufficiency is, usually a diagnosis that we make after we've ruled out major things, to make sure that we're not missing it. I'm not sure they get any credit for being transparent. All of us in the medical profession could see swollen ankles. And even when you're wearing a business suit. So the swollen ankles, bipedal edema, we can't really see if there's skin ulcerations or discolorization or anything else. So the first thing that we think of as physicians is, is he having heart failure? So they put out that his echocardiogram was normal, and they put out that his BNP, the blood test, was also negative. So I think that's appropriate. And then are they missing a DBT? And they put out that he had an ultrasound of his legs done and also a D dimer. So I think they're trying to address those. Other things that can do it is sometimes some, kidney failure. They said his comprehensive metabolic panel, which includes BUN and creatinine, is normal. So I think Dr. Barbabella just stuck to the facts of, hey, I thought of these other things. They got ruled out. So we made the diagnosis with the specialist of chronic venous insufficiency, which the two highest risk factors are age. He's old. He's 79 years old. And then if you are overweight or obese, he's had a lifetime of overweight, obesity in the past decade or two, and then also sedentary lifestyle. So, if you think of your grandparents who sit around a lot, if you golf and you ride a cart, that does not count as physical activity. If you notice all the pictures of him in his workspace, he is not standing up, moving around. He is sitting at a big desk. So my advice would be extremely common in old Americans who have sedentary lifestyles and are overweight. So sit less, walk more, and lose a bit of weight, and that should help with the swelling in the ankles.
Dr. Kuhlman, much as I would love to believe that the current president is listening to this podcast,
Yeah.
I think it's unlikely that we're going to, and knowing what little we know about his personality from the public side, whether he actually takes advice is another matter. But I guess I'd step back a second, and you've really done a nice job in your book at talking about presidential health, presidential transparency. How does the current level of transparency on health, and you could feel free to go back as far as you want, compare to best practice relative to what you'd like to see?
I think it's fine. He can go back as far as he wants, but not prior to George Washington. I don't know, just limit it. That's
it. That's legit. He had bad eyesight.
Yeah. So in transforming presidential health care, unfortunately, what you said is true. Most American presidents are very reluctant to actually kind of be truthful with the American people. And sometimes, if you have a doctor that's complicit in that, think about Woodrow Wilson and having a stroke, and he was debilitated for 9 months, up in the second floor in his residence, and the cabinet members were in on it. His second wife, she was in on it, and it was all facilitated by Carrie Grayson, who's the young, dashing doctor that, in his 30s got magically elevated from a lieutenant to admiral. So with the Hippocratic Oath since the beginning of time of more than 2,500 years ago, we should respect doctor-patient confidentiality, but we also balance that out with there's a fiduciary duty to the American people. So I tried my best to always be factual in the reports that I released for the different presidents, and not use hyperbole and not stick in extraneous information. But there's other people that have different styles, and they get rewarded for that.
Can we talk about cognitive testing? I first heard about you during the presidential election, where we had not just one older person running for office, but
Everybody
two.
was old.
Yeah. So, I mean, what's the argument for more routine cognitive testing, which I think is what you're advocating for? If you could lay out that argument, that'd be great.
Sure. So, since we're going back to 250 years ago, so James Madison was kind of the lead author of the Constitution. So when he submitted his final draft, to the uh, Congressional Congress, he was 36. He was 36 years old. The average American at that time, 20-year-old American, they were lucky if they lived to age 60. President George Washington, when he finished his office, he was 65. He died a year and a half later. So there was no concept of octogenarians at that time. In the Constitution, there is no physical or medical or mental requirements. And if you think about it, most presidents have had some type of physical impairment, which we can accommodate for. They're blind, they're deaf, they have a limb that doesn't work, they have different organs that don't work optimally, and we can accommodate for all of that. The only one we cannot accommodate for is critical decision making. So with critical decision making, which I laid out in Transforming Presidential Healthcare, now it's ancient history, like more than a year ago, of the one thing that we cannot accommodate for is critical decision making. It's a fact of life. It is not questionable that over the age of 60, humans start to have cognitive decline. So the cognitive decline they're having, it's memory, reasoning, speed of processing, spatial visualization, undeniable, those cognitive declines accelerate. Vocabulary, the fifth one, actually stays the same and sometimes it improves. So that's kind of unique. But so when you had a 79-year-old and 82-year-old who are running for that office, the MoCA, the Montreal Cognitive Assessment, 2-minute screen, 20, 30 questions. Absolutely, they're going to do perfect in that because they don't have dementia, they don't have Alzheimer's, which that's usually kind of what it screens out for. But it does.
Is that, Dr. Kuhlman, just to be precise, that is a test I believe that Trump very proudly aced when he was, basically kind of a C-spot run kind of standard of cognitive
and I have no doubt
clarity.
that he aced it. I think they're being truthful with that. But that's sort of like, hey, they showed me the Stalin eye chart, and I saw 2020
bunch of letters
or 2040 on it. And so absolutely that's a good screening test. But a 79-year-old, when they go to the eye doctor, they get a fundoscopic dilation. They get their retina looked at. They make sure they don't have diabetic retinopathy. They make sure that they don't have cataracts. They make sure they don't have glaucoma. So there's a whole comprehensive. So the same analogy would be, my opinion is, any national leader over the age of 70 would benefit from periodic, maybe once a year, neurocognitive assessment that checks their memory, reasoning, speed of processing, spatial visualization, maybe take a couple hours, and they could feed it back. Maybe don't release it to the public other than they had it done, but it would help. It would have helped Dr. O'Connor with President Biden. It would have helped Dr. Jackson and Dr. Conley with President Trump. And it's not just the president. We have over 20 senators are over the age of 70. We have a 91-year-old. We have Supreme Court justices that I think 4 of the 9 are over the age of 70.
So I guess, Dr. Kuhlman, if you think about applying that standard, at least, or that standardized test for a feedback mechanism for the principal, whoever that is, the president or a senator, and the team, is it precise enough to say, look, below this standard, we got to kind of take the keys away? I mean, for those tests, is there a go, no go level of competence, if you will, around critical decision making that you'd say clearly indicates impairment? You are no longer qualified to fulfill the obligations and responsibilities of the job of president.
So I think that most of healthcare, there's not a clear go or no go, but there's a range and there's a spectrum. So to me, if you do that 2-3 hour test and you do it every year or so, you can at least address that. Hey, he's still at the baseline from when he was elected by the American people last November. I think today or yesterday, President Trump is celebrating the first 6 months. I'm sorry, of this second term. So you could check over time and compare it to the individual of, hey, he's had a little bit of cognitive decline, but it's like reasonable age related. It's not all of a sudden he's dropped off that cliff. I think about my 85-year-old father that we've been following him for aortic stenosis over the past several years. So you get an ultrasound every 6 months. He's completely asymptomatic, and he just passed, kind of the numbers of that are worrisome, and so now they put a TAVR in instead of waiting for and he did great instead of waiting for the event of something catastrophic. So it's the same type of thing. We have a 79-year-old, and the next 3.5 years, he's going to get 82 years old, and he makes lots of mistakes in his speech. He makes lots of a mistake in his recall. Does he really, forget that he appointed the Fed chairman, or is that part of his political strategy? And I don't know. I'm not part of the political machine, but I would, as his personal physician, I'd want to know: is he losing his memory? Is his reasoning ability? Where the problem with old people, again, think your grandparents, is they don't listen to other people. They just do whatever they want, and so they've kind of lost that normal.
David's somewhat the same way.
Yeah.
Yes.
I've had that since I was 15, according to my mother. Now, you mentioned, Dr. Kuhlman, that this information would have been very useful, let's say, to certain physicians who are caring for President Trump in first and second term, President Biden, since President Obama, less of an issue since he was significantly younger. Yep. But it raises the question of, who should be the audience for this? It's one thing for the for the physician to have that, as opposed to just the MOCA or the E on the eye chart, which even I can read. Right. But who beyond that? I mean, you've spoken about kind of the whole structure of the about the medical office in the White House. Where do we go besides just the physician having access to that information?
Well, the physician to the president has, the higher you get, the more responsibility you have. So first of all, the patient you're taking care of, you have a responsibility to give them accurate information and not just something that they want to hear. So give them accurate information. Their spouse, their family, their senior advisors around them. With the permission of the patient, you would also want to share that with them. And then who do they work for? Well, they work for the American people. And President Obama, when we were planning his first physical, I asked him about certain things and said, hey, this is what we're going to do. And he said, I've learned never lie to the American people. Eventually they'll find out the truth. So that's what we tried to do is, we may not mention a bout of traveler's diarrhea after coming back from a certain country because that just wasn't relevant. Or we may not, mention every hemorrhoid or skin tag or, day-to-day situation. but I made sure that cardiovascular, cancer, neurocognitive, that those things that affected the duties of the president were reasonably explained and competently evaluated.
Dr. Kuhlman, it's got to be, everybody's got to feel pressure of politics when you're in these jobs. I think back to, the claims that a lot of President Kennedy's illnesses were shielded. I think of the pressure that Eisenhower's doctors were under when he went through, multiple heart attacks and President Johnson's heart attacks. The question of how much do you disclose without impacting the image of effectively power and strength of the United States is very much tied to the leader. How do you navigate that as a doctor in the White House, the pressure of doing the right thing for the country around disclosure versus the perhaps the political thing, which is to present the president as stronger than he or she may be relative to their actual health?
That's the dilemma of being a physician and every single patient that I take care of. So number one, I make sure that I have a higher level of understanding of what I'm doing. Number two is integrity. You got to do the right thing whether anybody's looking or not. You have to have the appropriate level of formality in your communication, formality of following procedures. You have to have a questioning attitude, and you have to kind of, back each other up. So there are, lots of doctors in U.S. history that they are willing to sell out for personal gain, for political gain. And if you look at history, the ones that have been unsuccessful, it's usually that they've crossed the line over into friendship instead of staying on the correct side of the line of the doctor-patient relationship, which is information relationship built on trust. And so that's every patient that you care for, you have to make sure that you follow those simple rules.
So John mentioned that he's not sure whether the current president will listen to this podcast and take your advice, no matter how valuable it would be to him. So I'm wondering, for others, business leaders, hospital CEOs, military officers, what can they take from your insights into presidential
podcast
medicine?
Podcast hosts.
Yep.
What can they apply for their own organizations?
Yeah. So that's a really good question. If that sort of goes on VIP or concierge care, and often those are high net worth individuals or CEOs. They often don't have enough time. I would make sure that you find that you don't think you're smarter than the personal physician that is caring for you. There's famous quotes about if a patient is their own doctor, then you have a fool for the patient and the doctor. So there is no shortcut to good health care. Actually, health is just the absence of disease, but fitness is the fountain of youth. So the fitness is, it's not a secret, is live a physically active life, progress to a more plant-based diet, be temperate in your personal habits. It's best if you don't smoke. It's best if you don't drink alcohol, or you're temperate in that. And then also you have a positive outlook, and you have those, invest in community or personal family relationships. That's the secret to good health. find a physician that has integrity, that follows evidence-based medicine, which unfortunately is only about 20% of healthcare.
But you're also, Dr. Kuhlman, you're also reinforcing the notion that you may be the CEO or leader or general in when you've got your uniform on, but when you've got the white coat that opens in the back,
Yep.
basically a poorly fitting apron,
Yep.
you listen to the person with the degrees and the experience, and I do think that's an important. That for any leader, that's sort of a critically important piece of advice. So I think that's before we get to moving around and reversing aging, you got to first listen to the doctor.
Right. Yeah, and history is full. It's in transforming presidential healthcare. The Steve Jobs, Michael Jackson. The list goes on and on. Of they thought they were smarter than the doctors, or they found a doctor. Matthew Perry. Anna Nicole Smith, Elvis Presley. There's a whole list of just celebrities, ultra high net worth individuals, and often you think they have the best care, and they often have the worst. And so you gotta find a physician, and who he or she will have solid information, communicate to you, and you have to make the decision to listen to them and follow their guidance.
Well, that's it for yet another episode of the CareTalk podcast. We've been speaking today with Dr. Jeffrey Kuhlman. He was physician to President Barack Obama, and he's the author of Transforming Presidential Healthcare. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the head of UConn Health. If you liked what you heard or you didn't, we'd love you to subscribe on your favorite service. And Dr. Kuhlman, thank you so much for joining us and reminding us of the importance of science, healthcare, and following the best advice of doctors, even if you happen to be the president.